Hello and welcome to this video on 15 chronic obstructive pulmonary disease treatments. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes it difficult to breathe. It's often caused by smoking, but can also be caused by exposure to air pollution and other environmental factors. There is no cure for COPD, but there are a number of treatments that can help manage the condition and improve quality of life. 1. Inhaled bronchodilators are medications that help to relax the muscles in the airways, making it easier to breathe. These can be taken as needed, or on a regular basis to keep symptoms under control. 2. Inhaled corticosteroids are another type of medication that can help to reduce inflammation in the airways and improve symptoms. 3. Oxygen therapy involves using a machine to deliver extra oxygen to the body. This can be helpful for people with severe COPD, as it can help to improve energy levels and reduce the risk of hospitalization. 4. Pulmonary rehabilitation is a program that involves exercise and education to help people with COPD manage their condition. It can help to improve muscle strength and endurance and teach people how to better manage their symptoms. 5. Lung volume reduction surgery is a procedure that removes damaged tissue from the lungs, making it easier to breathe. This is usually only recommended for people with severe COPD who have not responded to other treatments. 6. Lung transplantation is another option for people with severe COPD. It involves replacing one or both of the damaged lungs with healthy ones from a donor. 7. Smoking cessation is a crucial part of COPD treatment. Quitting smoking can help to slow the progression of the disease and improve symptoms. 8. Air purifiers and humidifiers can help to improve the air quality in your home, making it easier to breathe. 9. Physical therapy can help to improve muscle strength and endurance, making it easier to do everyday activities. 10. Occupational therapy can help people with COPD learn how to manage their condition at work and at home. 11. Nutrition therapy can help to ensure that people with COPD are getting the nutrients they need to stay healthy. 12. Palliative care is a type of care that focuses on providing relief from symptoms and improving the quality of life for people with serious illnesses. 13. Clinical trials or research studies that test new treatments or therapies. Participating in a clinical trial can be a way to access new treatments that are not yet widely available. 14. Support groups can provide a sense of community and emotional support for people with COPD and their families. 15. Home care services, such as home health aides and nursing care, can help people with COPD manage their condition at home. These are just a few of the many treatments available for COPD. It's important to work with your healthcare team to find the best treatment plan for you. Thank you for watching this video on chronic obstructive pulmonary disease treatments. If you or a loved one is living with COPD, remember that there are options available to help manage the condition and improve your quality of life.